Call it an unintended consequence. A new rule affecting those requesting legal status, also affecting public health.
It's all based on a misinterpretation of the rule. We asked the USCIS acting director about it today. Channel 5's Valerie Gonzalez in our studio with more.
It's called the Public Charge Final Rule. It places limitations on those applying for things like green cards and visas based on what public benefits they receive. But it's confusing families who are opting out from getting medical treatment altogether. Valley residents come to Nuestra Clínica del Valle, knowing this is a place they can receive free or reduced health care services. Lately, some are missing appointments.
That's my department. We schedule appointments for patients, and they'll say, "Y me va a perjudicar?" And most, it doesn't.
Graciela Castillo is a social worker here. She says patients are concerned with the public charge rule. USCIS created the rule that will go into effect soon. It restricts what public benefits will be considered against those who have an application for things like green cards or visas. Many fear getting their family's medical attention will also count against them, so they're just not coming. USCIS Acting Director Ken Cuccinelli explains there's a misunderstanding.
We still have a communication challenge that we've been focusing on to try to make sure people who do qualify for benefits Congress says they have a right to, what is covered by public charge and what is not.
Certain things won't count against applications with USCIS.
And things like school lunches were removed, WIC is out, CHIP, healthcare for children, is excluded, and the list goes on.
A lack of comprehension of this over 800-page rule is also leading to rumors.
I've heard people say they can't get their documents if they are receiving CHIP or food stamps.
That's what Maria Guzman, a patient of 15 years, hears from others in the valley. Families with U.S.-born children are too fearful to claim benefits they are legally entitled to receive. These questions come to the social work department.
Can we come? Are you going to ask us about, our residency, our legal status? And we do, but for other reasons, not because to see if they're going to qualify for a certain, if we need to refer for other assistance that they need.
A social security number is not required to get help at this clinic. Any information they collect is private. It is not shared with government agencies like ICE. They offer services like internal medicine, family medicine, pediatric services, nutrition, counseling, or x-rays. Pain brought Guzman today.
What happens is that I'm having problems with the heel of my foot.
An expensive outside quote for an x-ray forced her to wait it out.
I went to get a particular doctor. I went to go get some studies done, the ones I'm getting now here, and they were going to charge me a lot. So I just put up with the pain and waited to come here.
The cost for her x-ray went down by about 83% by coming to this clinic. In a place like Hidalgo County with a high uninsured rate of about 31%, every penny counts. The final charge rule is over 800 pages long. USCIS created a short list of what counts and will not count as a public charge. We'll have a link to that website after our newscast. The rule is set to go into effect October 15th. In the studio, Valerie Gonzalez, Channel 5 News at 6.